Special meeting to order. This is in reference to the governor's latest executive order, number 20-68, and I think, Leslie, if you would, please, since you authored all this, would you read it to us?
Well, I didn't author the governor's executive
Yeah, I know
order.
that. We wanted to, I know, but
Okay, so as Terry has indicated, on November 18th, the governor issued Executive Order 20-68. And what 20-68 is a mandate for masks in the state of Kansas, whereby, to summarize her executive order, what she is promoting is that everyone wears a mask all the time, is what it boils down to.
while in public.
While in public. Right. Now, because this is an executive order, House Bill 2016 allows each county commission to come in and opt out of these executive orders. But in order to opt out of an executive order, there's a criteria that the commissioners must go through before making that decision. The first is that they have consulted with the local health officer or local health officials regarding the governor's executive order. That following such consultation, implementation of the full scope of the provisions of the governor's executive order are not necessary to protect health and safety of the county, and all other relevant findings to support the board's decision. The reason that we are here today is the governor has put a deadline of November 25th at 12:01. Her executive order will go into effect. So if there's going to be any action on the part of the commissioners, either deciding to go with the governor's order or opt out of the governor's order, has to be done prior to that time. So that is kind of a basic outline, as briefly as I can put it, as simply as I can put it, as to what is going on. As everyone is aware, the EOC has been activated due to a declaration of emergency. And so there is a committee that meets every Friday to discuss the status of the COVID pandemic situation in Cheyenne County and how it is affecting the community. The committee did meet last Friday and have a recommendation for the commissioners. Now, I cannot emphasize enough, it is the commissioners' decision in regards to what is best for the community. Recommendations can be made as to different positions regarding a mask mandate, but it is the commissioners' final decision, or it is their decision that will prevail in regards to this issue. In any event, after a lengthy meeting with the team on Friday, it is the recommendation of the EOC that the commissioners opt out of this executive order, for the reason that the governor's executive order is very far-reaching with the requirements of the mask wearing in public. For example, if you have someone who is an office assistant and they are sitting in their office, they have to wear a mask all day, all the time, because just in case someone from the public were to walk through that door. Under her order, that individual has to wear that mask the whole time that they are in that office. It was the committee's belief that that is a little far-reaching for individuals, especially in rural communities where sometimes there's not that much foot traffic or there's not that much interaction with the public within an office setting. And so in the recommendation that the commissioners opt out of the governor's order, it is further recommended that there be a county health order regarding face masks. And the impetus of that public health order would be, if you cannot social distance, meaning stay 6 feet apart, or you do not have a barrier, like the plastic or the plexiglass barrier between you and the consumer, then you must wear a mask when you are in public, outdoors, or events, activities, whatever the case may be. It boils down to, if you don't have those two factors, 6 feet or a barrier, then it is going to be required that a mask be worn, is the recommendation. By doing a public health order, it keeps the situation more fluid, so that if things were to change, that order could be changed rather than going back in and changing resolutions, etc. It can work with the times, so to speak, so that, you know, if things start to get worse, then more restrictions can be put into place. If things start to get better, then those restrictions can be loosened.
And I might say we can do that if we pass this type of resolution. We can do that without the governor's support or not. Because she's left that door open to the counties to make that kind of decisions.
Correct. Correct. So, a resolution, and furthermore, a public health order is countywide and covers every citizen, agency, entity, business, etc. in the county. It was the committee's belief that the schools need to have their independence to make decisions for their students when it comes to mask wearing. And so what is being proposed to the commissioners in the resolution and the public health order is that the school districts will be exempted from the county health order. So that way they can come in and implement their own rules, policies, procedures, whatever they deem appropriate for their students, and not be under the mandate of the county and what is being implemented countywide. We felt that was important because we want to, we want the schools to have that ability to stay open as best they can, and the students to be as comfortable as they can during this time. So that is the recommendation of the EOC to the commissioners. And I have gone ahead and drafted paperwork in the event that that was the route that you commissioners wanted to go. However, it still is in the commission's sole discretion as to if Cheyenne County will or will not opt out and what steps will be taken from there. So I don't know if you want to open the floor to comment.
I think so. If you've got some comments or some input, we'd like to hear it. Be brief, please, and try to make sure that the information you're relating is as accurate as you know it. Because as we all know, the problem, misinformation and misunderstandings is unbelievable, to say the least. So if anyone does have, we'll give you the opportunity to make some comments.
Will it last until you decide? Is there a specific time period that this is lasting?
When it comes to situations such as this, and Ryan, you're better at this than I, it's the length of the declaration of emergency, correct? Or until rescinded?
Until rescinded.
Okay.
So personally, my recommendation would be that it is in effect until rescinded, but it will be reviewed every 30 days.
I see no problem with that. That makes sense. Because as we know, we've noticed in the past 3 months, it's dramatically changed in a lot of places. So if you left yourself no room to maneuver, you're just stuck. So I think with this resolution, it fits the needs of the community, but yet it leaves us some options if those needs arise.
Let me correct you. So the resolution, and Leslie, correct me if I'm wrong, the resolution is to opt out of the governor's order.
Yes.
Then we will issue, or you gentlemen will issue or sign a public health order. That is different than a resolution per se, but basically that order is in effect until
Rescind.
County Health and yourselves rescind the order.
Thank you. That is correct.
But we will be reviewing it every 30 days.
As needed.
I mean, I don't think we need to lock ourselves into a long period of time. It's going to be on a, it needs to remain fluid, I guess.
Oh, I agree, because things change, I mean, obviously. Anyone else like to say a few words? We have received a lot of, I know, as commissioners, we've received a lot of
Correspondence.
yeah,
Communications.
communications, input, whatever we want to call it. The majority of it, the majority of people that have contacted me has been for a mask mandate of some sort. Very few have come forward, at least to me,
I've had a couple.
and they've tried to come to me, and it's like any other public safety rule, whether it be wearing a seatbelt, stopping at a stop sign, having your kids inoculated. They're public safety rules. They're meant to serve all of us, not individuals. So, with that in mind,
I do have a comment.
yes.
Yeah, I did. I thought others would. In Bird City, I've been with Willie and I've had some discussion. Leslie, I guess my only concern is the business owner themselves. And I'm talking about, I'm assuming all public places, all tax supporters will follow this guideline as well. But, for example, over there, we have like Big Ed's. So if that business owner says, hey, you can come in here with or without a mask, is there consequences?
There's a special provision in the public health order for restaurants. And what it is that you have to wear your mask. Basically, you wear your mask until you sit down, and the tables and booths have to be 6 feet apart.
Yeah.
There's no sitting at the bar, because you can't technically social distance per this public health order. But you can still,
Yeah.
stay open
Stay.
as long as your tables and booths are 6 feet apart.
Okay.
Okay?
Yeah.
And Brian?
Well, I will say, on that one specifically, in the governor's order, it states that you can only take off your mask at a restaurant unless you are 6 feet apart, except with members of the same household. So in essence, Commissioner Ryder and I could not go out to eat unless we were 6 feet apart. Part of what the EOC, that's why we're saying we opt out of the governor's order
Yeah.
as written, and we have changed that to be more
Just 6 feet.
fit our local environment to where it's, the tables and booths are 6 feet apart. We don't match, it doesn't matter who's at that table. Does that make sense?
Yeah.
Because the people that are going to be at the table is by consent of the parties.
That's great.
Yeah.
Are we looking at occupancy limits at all? Or
No,
just-
we're not looking at occupancy limits so long as they can honor the 6 feet apart.
And then my next would be the grocery store. Tell me about the rules for the grocery store.
Well, when it comes to the grocery store, it would seem to me that,
I think to simplify everything, Rod, is if you can't maintain a
Right.
6-foot distance with another individual, you need to have a mask on.
right, so if
So
you,
that-
if you turn and you're going down an aisle and you're passing someone, you better have a mask on. So grocery stores, you're probably going to need a mask, just because of the nature of a grocery store.
Unless they
And
do
the
like
the
Walmart,
volume
one-way
traffic.
direction up and down the aisles. I mean, it doesn't work, but
There are only two businesses, and
Yeah.
and the thrift store. And,
What?
John's not opposed to this in any way, shape, or form. So-
I still think, Rod, just keep it at its simplest form. If you can stay at a distance at more than 6 feet, you should be all right. But if you're going to be within that 6 feet zone, you need to have a mask on,
Okay, then
But-
my-
and- Another
regardless
thing-
of where you're at.
Yeah, another thing that you must keep in mind too is businesses can be more restrictive. If they want everyone to wear a mask, coming
Yeah.
into their establishment,
That's
they
all
can
right.
require that.
Oh, yeah, and I think some will, and I'm not opposed to that. And I guess then my very last question is, how we don't put our law enforcement in a position where, who's the enforcer?
Okay, so dependent on which direction the commissioners go, there are two ways that this is handled. If it should so happen that you are under the governor's executive order, House Bill 2016 came in and wiped out the criminal penalties for a violation of a governor's executive order, whereby it is now a civil penalty and it runs through the county attorney. If it should so happen that the commissioners decide to opt out of the governor's order, then you are under public health orders in the statutes and not governor's executive orders. Now, under public health orders, those are still classified as crimes because House Bill 2016 didn't reach into those private health orders, or I should say private, but local health orders and change the laws in regards to those that I can find. In reading House Bill 2016, it is specific to the governor's executive orders. So when it comes to a violation of, the public health order, what I'm going to request is if there is a complaint, that the complainant is going to have to make a written statement and have it sworn to in front of a notary and turned over to law enforcement, which Cody and I will sit down and go through a list of factors as to if the case should proceed or not.
Okay.
Okay? And if it does, then we'll take the appropriate action if necessary.
Yeah, not just a phone call and a complaint type of thing. I'd rather.
No.
Good.
No, in regards to a situation such as this, if there's going to be a complaint, that person's going to have to step up, put it in writing, sign their name in front of a notary, and get it to law enforcement.
Sounds good.
Okay?
I can see this affecting public gatherings more than an individual.
I do too.
Now, for instance, say like Big Ed's, the people would not be able to sit at their bar at all?
Unless they can be 6 feet apart, but we don't have any provision for that type of seating in restaurants. It's only seating for tables and booths.
The language in the order only addresses booths and tables. Why bar stools were left out, I don't know.
Because it's hard to social distance.
Yeah.
I mean, not only
With
this
the
way,
staff.
but also with the staff.
Unless they had a mask on.
Right, they're wearing a mask.
I-
But you can't sit there and consume
Yeah.
with a mask on. So, I mean, it's logistics.
Quickly, does the staff have to wear one? Just because, like waiters? Yeah,
It goes back to the 6 feet thing.
they will be with it.
Yeah.
Okay.
Man, I could see this going to be a nightmare because we're going to be issuing everybody a ticket, especially in
I don't
that.
think so.
I don't think so either.
See, Willie, they won't go through the process of what she's saying. They're not gonna file a complaint, take you interview, affidavit, do all of it. I think they've covered that.
None of us like to wear a mask. We don't, but we know we are at that point in this situation where we have to do something to lower the exposure rate right now. We have 22 active as of right now, and at this point, more people are susceptible to wearing a mask for maybe 30 days or 60 days to see how we do there, come back, reevaluate it. They're more apt to do it right now to help out. They are understanding how many people we're sending out here on event. We have 9 deaths in the community right now as of this morning. 9 deaths in this 2,600 town population. That's a lot for this disease. So I think you'll be surprised at more people that will cooperate. None of us like to wear a mask, but we know we're at that point where we need to.
This is not a punishment thing.
No,
It's a
Right.
public health issue.
right.
Well, I would just like to also add, when we opted out, or when you gentlemen decided to opt out before, a lot of us supported that. And that was, at that point in time, the situation did not require this sort of mitigation. The situation has changed now that we're 2-3 months, however long ago that was.
We made the comment in an open meeting
Correct.
that we were on board with opting out of the governor's executive order until we started seeing a rise in cases and deaths in the county. Well, that has occurred, so it's time to do something.
The other thing we have to keep in mind is our local healthcare system, they're tired. They've been dealing with this for months. The hospitals are full. outside of here. We're hearing of hospitals, I just heard in Rollins County, they ended up sending someone all the way to Texas because that was the closest available bed. This affects more than just COVID patients. This
Yeah.
is stroke, this is heart attack, getting people where they need to go. The hospitals are full.
This is no time to be selfish.
Correct. It's a time for us to step up, and if it helps a little bit, so be it.
Yeah,
That's
I'd be,
the goal.
I'd be extremely curious about our numbers after 30 days, if we can get everybody to wear a mask.
Is it 100% effective?
No.
But if it helps a little bit,
It lowers the
Yeah.
transmission rate.
And I'm sure you track those numbers pretty closely.
Well, according to the news anyway, it says all of the other countries who do wear them are better off than we are, because they do stop it.
Yeah, it lowers the transmission rate.
But like I say, the only bad thing is getting people to do it.
Yeah.
And I think the important thing about the approach that we take is that nobody's asking for this to be a heavy-handed, we're not gonna have the mask Gestapo out there chasing people around. You know, we're not gonna assign deputies to be the mask deputy to go around and check people. We're not going out randomly walking into businesses going, oh, they're 6 foot, they need to be wearing a mask, I'm gonna write them a ticket.
It's an individual
It's an
responsibility.
individual responsibility, and people got to take it upon their own shoulders to do things, and that's what we're asking the citizens to do, is to take it on their shoulders. And take a little bit of responsibility. Like I said, we can debate all day the science of whether it works or not.
Well, and the bottom line is, the only thing you're giving up is a little bit of inconvenience. I mean, it doesn't take money out of your pockets, it's an inconvenience to you personally, but it may pay in huge benefits as far as the overall health of our community.
And I can't speak for any other department, any other business, any other entity in the county. But I can speak for the sheriff's office. We've had 4 employees at the sheriff's office have COVID. One of them was flown out. One of them hardly had any symptoms. It's the whole range of the gamut. But within the sheriff's office, 3 of my employees have lost a grandparent to COVID. So, you know, there's the other side. Does a 23-year-old young deputy make it through okay? Yeah. But look how many grandparents of people who work at the sheriff's office have been lost. And any chance we have to take something, a reasonable step, I think we should take it.
I agree. Do we have anybody else like to make a comment? All right, well, let's move forward then. Leslie, would you read the public health order?
Do the resolution.
Resolution first, or?
Yeah, you have to do the resolution first. You have
Okay.
to opt out before the order.
Okay,
If
Rick.
that's your decision.
Yeah. Well, I suppose. She said that a few times here, guys.
I'm not telling you what to do. Just suggesting.
So you need a motion to opt out?
Well, no. Let's take this one
No?
step at a time.
Okay.
Is everybody kind of in agreement with all the discussion we've had here this morning?
I am.
Or this afternoon, I'm sorry. Okay, well, basically, I think we have a decision to make from 3 choices. One, we can opt out completely. 2, we can comply by the executive order issued last week by the governor. Or she's given every county an option to come up with their own resolution that addresses the mask issue. So you basically just have the 3 choices.
I personally would be in favor of opting out from the government, from the
Governor's order.
governor's order, and making our own, or doing our own.
Roger?
I guess I don't have anything to say about it. I've got a lot of people that don't want to wear masks.
Sure.
I've
But there
had
again-
more not want to than do.
And I've had more positive, so it's
I've
one of
had-
those things where you're not going to please everyone. There's no way.
I've had more positive than negative, but the negatives they're still out there.
Oh, yeah. Okay. This is resolution 20-11. A resolution issuing an order from the Board of County Commissioners exempting Cheyenne County from Kansas Governor's Executive Order Number 20-68. Whereas KSA 19-101 provides that a county may exercise the powers of home rule to determine its local affairs and pass local legislation to govern said local affairs under the provisions of KSA 19-101A. Whereas Section 33 of House Bill 2016 and KSA 48-925H provides that the Board of County Commissioners of Cheyenne County, Kansas may issue an order relating to public health that includes provisions that are less stringent than other provisions of an executive order statewide issued by the governor. Whereas the Board of County Commissioners, in consultation with the county health officer, wish to exempt Cheyenne County from Executive Order Number 20-68 when it goes into effect at 12:01 a.m. on November 25th, 2020. And whereas the Board desires to adopt a resolution for the purpose of issuing its order in accordance with Section 33 of House Bill 2016 and KSA 48-925H, to provide less stringent provisions than those found in the Executive Order 2068, and to establish the appropriate findings required by law for less stringent provisions. Now, therefore, be it resolved and ordered by the Board of County Commissioners of Cheyenne County, Kansas as follows. Number one, that the Board of County Commissioners have consulted the Cheyenne County Health Officer in regards to Executive Order 20-68, requiring any person in Kansas to wear a mask or face covering, effective at 12:01 a.m. on November 25th, 2020, while in a public space. That, after consultation with the Cheyenne County Health Officer, the Board of County Commissioners find the implementation of the full scope of the provisions in Executive Order 2068 are not necessary to protect the public health and safety of the county. Number three, that the unified school districts within Cheyenne County will tailor and place into effect rules, policies, procedures, and regulations for their school district relating to face coverings that the Board of Education, after consulting the Cheyenne County Health Department, deemed best suited for the health and safety of their students. Number four, that Cheyenne County will tailor and place into effect a public health order excluding the unified school districts relating to face coverings that the Board of County Commissioners and the Cheyenne County Health Department deemed best suited for the health and safety of Cheyenne County. And number five, this resolution does not prohibit a business or organization in Cheyenne County from requiring its employees, customers, visitors, invitees, or members to wear a mask or face covering while in or at such businesses or organizations, while on its premises or property, or while at any event or activity of such business or organization. And number six, this resolution shall become effective on November 25th, 2020 at 12:01 a.m. I've got to change the date. Yeah, today's not 19th, 25th. Okay, now I'm open for a motion.
Okay, I'll make a motion to opt out of the governor's executive's mandate.
Okay, that'd be Resolution 20-11 that I just read.
Which is 20-11.
Okay. I'll second that motion. All those in favor? Aye. All opposed? Okay, so we're going ahead and adopt Resolution 20-11. Now, the public health order. Would you like to do that one, Leslie?
You want me to read it?
How about we're out?
Okay. This is a public health order of Cheyenne County regarding COVID-related mitigation procedures and excluding the unified school districts in Cheyenne County, Kansas. Whereas on the 23rd day of November 2020, the Board of County Commissioners of Cheyenne County, Kansas considers Executive Order number 20-68 issued by Kansas Governor Laura Kelly to go into effect at 12:01 a.m. on Wednesday, November 25th, 2020, as well as Resolution number 20-11. Whereas the Board of County Commissioners find that a disaster has occurred or the threat thereof is imminent within Cheyenne County, Kansas as a result of the coronavirus pandemic and the confirmed outbreak and person-to-person spread of COVID-19 in the United States of America, the state of Kansas, and Cheyenne County. Whereas as a result of the coronavirus pandemic, Kansas Governor Laura Kelly issued Executive Order number 20-68 to go into effect at 12:02 a.m. on Wednesday, November 25th, 2020, mandating the wearing of masks or face coverings in public. Whereas the Board of County Commissioners of Cheyenne County, by way of Resolution number 20-11, exempts Cheyenne County from the mandates of Executive Order number 20-68, thereby not requiring adherence to the Governor's Executive Order, but instead allowing the Board of County Commissioners of Cheyenne County and the Cheyenne County Health Officer to tailor and implement a public health order that they deem is best suited to protect the public health and safety of Cheyenne County, and further allows the unified school districts from said public health order, allowing each of the unified school districts to implement policies, procedures, and regulations for their school districts relating to face coverings that the Board of Education, after consulting the Cheyenne County Health Department, deemed best suited for the health and safety of their students. Whereas the Board of County Commissioners has consulted with the Cheyenne County local health officer regarding the outbreak of COVID-19 cases in Cheyenne County, and they need to take precautionary measures to mitigate the person-to-person spread of COVID-19 in Cheyenne County. Whereas the wearing of masks or face coverings while in public space in Cheyenne County is recommended to mitigate the person-to-person spread of COVID-19 in Cheyenne County in conformance with the requirements located herein. Whereas pursuant to KSA 48925H, the Board of County Commissioners may issue an order relating to public health after consultation with the local health officer that includes provisions that are less stringent than the provisions of an executive order issued by the governor. Now therefore, the Board of County Commissioners of Cheyenne County, Kansas, pursuant to KSA 48925H, to mitigate the person-to-person spread of COVID-19 in Cheyenne County, direct and order the following. The unified school districts in Cheyenne County, Kansas are hereby exempted from this public health order and are allowed to implement policies, procedures, and regulations for their respective school districts relating to face coverings that the Board of Education, after consulting the Cheyenne County Health Department, deems best suited for the health and safety of their students. Number 2, effective 12:01 a.m. Wednesday, November 25th, 2020, any person in Cheyenne County, Kansas shall cover their mouth and nose with a mask or other face covering when they are in the following situations: in all indoor or outdoor public events or waiting in line to enter such where there is exposure to non-household members, where 6-foot social distancing cannot be maintained or barrier is not present between individuals. All businesses and organizations shall require employees, customers, visitors, members, or members of the public to wear a mask or other face covering where social distancing cannot be maintained or a barrier is not present when employees are working in any space visited by customers or members of the public when members of the public are present. Employees are working in any space where food is prepared or packaged for sale or distribution to others. Customers, members, visitors, or members of the public are in a facility managed by the business or organization. Employees are in a room or enclosed area except infrequent or incidental moments of closer proximity. The following are exempt from wearing masks or other face coverings in situations described in paragraph 1. Children under the age of 5, persons with a medical condition, mental health condition, or disability that prevents wearing a mask or other face covering, persons who are seated at a table or booth at a restaurant or other establishment that offers food or beverage service provided they maintain a 6-foot distance between tables and booths, persons engaged in religious worship activities, however, masks or other face coverings are strongly recommended, performing job duties where a 6-foot distance from others can be maintained, or performing job duties where a 6-foot distance from others cannot be maintained, but use of a mask or face covering is inhibitory to the ability to safely and effectively perform the job duty. This order is to be reevaluated by the Cheyenne County Board of County Commissioners and the Cheyenne County Health Officer on December 15th, 2020.
Thank you.
Made me tired.
A lot of words, a lot of big words.
No, because this is when ours goes into effect. Ours goes in as level 1 and ours is level 2. The order The 25th at 12:01 a.m.
Okay, gentlemen, do I hear a motion to go ahead and adopt public health order of Cheyenne County regarding COVID-related mitigation procedures and excluding the unified school districts in Cheyenne County, Kansas?
So moved.
No second.
All in favor? Aye. All opposed? Same sign. Okay.
Signature page. Did you motion the first one, the resolution?
Yes.
That's what I thought I heard.
All right, do we have any other discussion or anything we need to follow up with?
I don't believe so.
Okay,
I am going to look further into the enforcement because of the, in regards to the governor's executive orders and the civil penalty and the criminal misdemeanor nature of violation of orders, because it's kind of all over the board with the
yeah,
state.
it would be super nice though if we didn't have to worry about that portion of it.
Right. Which, I mean, it's just a matter of hopefully people will see the benefit and take advantage of it.
Yeah, that's the hope. Yes, ma'am.
I've gotten some information from Secretary Tolan with the Department of Commerce, and what he did was send out their basic requirements for their windows, protecting healthcare workers. Some are just businesses and some are wearing masks. Anybody would like these, there's a bunch of different ones. If you want to look through them here, that's fine. Or if you know somebody that wants to put one in their window of their business, they can stop by the office.
Okay, thank you, Ellen. All right, do I hear a motion for adjournment?
Motion to adjourn.
Second.
All in favor?
Aye.
Man, how you gonna do this in the paper?